Jab it right into the patient's face.
Doctor, I think you're supposed to be operating on the heart. Shut up, nurse!
Parkour injuries, lots and lots of botched surgeries, and trying to save Bob. Today, we're reacting to some of the wildest medical scenes and injuries from the highly popular YouTube creator, Markiplier. Let's dive right in.
Yeah, your scalpels.
Scalpels.
Over on the right.
Yes.
You pick those up with just your forefinger and your thumb.
Okay.
Very delicate.
There are different ways to stabilize a scalpel. You definitely want to pinch it basically and then have it on the palm, or you can go one above or one below to stabilize it as well. So there are the appropriate techniques.
Very delicate. Not telling you to now. Put
right.
down. Scalpel, sir. Put it down.
I think we need it.
We got what looks like to be feet, and then there's random open intestines just laying there. Skin's already off and they've already used the scalpel. Typically you're not going to use the scalpel for anything else. The scalpel in the operating room is to make the first incision on the skin, and then that's it.
Put it down.
Okay, dropping it.
Oh man, okay, so sometimes it does happen where you actually drop medical instruments inside the abdominal cavity when you're doing surgeries, and you may or may not be able to find it.
Excuse me?
So they actually do an x-ray to check to see where it is. And this, you hear the monitor in the background going with the asystolic sound of like. This would really only happen if this scalpel sliced the aorta as it's running through the abdomen and you're bleeding out that fast. So typically not, but that's actually really funny.
Well, come. Do you know how to
Get the spoon.
Oh, I dropped the spoon.
I don't know why they need a spoon.
Spoon!
And I wonder why a scalpel stuck so intensely in the abdomen as well.
Oh my god, that was the only tool we could use to scoop it out.
I got it.
Oh god.
I got it.
He put his hands inside the abdominal cavity. Actually, that happens all the time. You're in a sterile gown, you have sterile gloves on, but you use your hands because of the dexterity of being able to feel the tissue. You're not as rough, it's more of a blunt object versus something that is sharp.
Wait, shut up. There's
Wait,
another
get the
spoon. There's another spoon. Oh my god.
Blood, when it starts to dry, gets actually really, really sticky.
Is it sticky?
So unlikely that something would slip out of your hands. You'd actually have more control over it.
Oh god.
Has anybody had muscle twitching when you're getting stressed out or annoyed? You actually can have some twitching of your eyelids.
Look at my eye twitching.
It does actually occur. It just has to do with the muscle contractions and nerve firing.
I'm just gonna grab one of these needles here and jab it right into the patient's face.
Doctor, I think you're supposed to be operating on the heart. Shut up, nurse!
If I, as a physician, ever yelled at a nurse that way, I would lose my job and I wouldn't get anything done. The nurses pretty much run the show. They're a lot more hands-on than the doctors are.
All right, we're doing pretty good. By pretty good, I mean pretty badly. What have I got? I don't even know what I got. There we go. Ripped a rib out.
What? Typically they're not taking ribs out. I think that's probably an accident. Ribs are small. They kind of are about a C-type shape. I know people get them removed for cosmetic purposes. Typically there's not a reason to have a rib removed.
Just like I'm supposed to. Just like Daddy taught me. Daddy, he never thought that I could be a doctor.
Why does his dad look like the Monopoly man, but with hair?
You must be the Monopoly guy.
I just ripped out his lung. Don't think I won't do the same to you.
The lung is bigger, it's spongy, multiple different colors depending on the damage that might be done to the lung if you smoke or not smoke. You should definitely Google a lung of a smoker. Anatomy-wise, it actually looks quite interesting.
Ah, come on, Bob. Cooperate with me, Bob. Cooperate with me.
Sometimes you actually do see some breakdowns of surgeons in the operating room. Very infrequently does anybody lose their proverbial poop.
So it's freshman year. I wanted to do like an activity. What I tried to do was parkour.
Parkour!
It was like supposed to be a quote unquote beginner parkour thing.
Okay.
We're jumping around the 4th level of the parking
What?
garage. Time to drop from the 2nd story and do a sweet tuck and roll into this little grass patch.
Yeah, don't do that. Tuck and roll. So I've always told people if you're falling, you need to hit and then roll. You can displace the energy.
I drop. And I landed from the 2nd story straight onto
Oh, straight onto his ass. Ow. We see a lot of people who have injuries where they fracture their coccyx bone, which is your tailbone, causing a lot of pain.
I felt something pop weirdly no pain.
That's not good. You hear popping noises. Could be a fracture, it could be a dislocation, could also be a rupture of some tendons or ligaments, and also disc herniations could make you feel a pop, which then because you feel it, you think that you hear it, but it's actually internal.
And then the guy behind me is about to go. And he drops. And instead of falling on his he fell on his face.
Oh no.
Like his legs hit, he went forward.
Oh.
He did not roll.
Oh my gosh. So fall down, hit your head, snap your neck. You can definitely cause vertebral fractures, intracranial bleeding, skull fractures.
So, you know, after a while, we're just standing there. We're looking at this guy dying on the ground. And we're like, oh, what do we do? What do we do?
If you're actually around somebody that has this type of injury, please call 911. Stabilize them, don't roll them around, don't move them, and get them to the hospital ASAP.
Like straight up, his ribs are broken.
Oh my gosh, broken ribs are the worst. It's not like you can split them. So every time you take a deep breath, you're causing pain. You're moving the broken pieces of the rib fracture.
So I drop and I'm like, forward, forward, forward. I saw them roll on like their shoulder. And so my legs hit the ground. I go forward and I put 100% of my weight right onto my shoulder.
Oh man. Our bodies are made to bend a little. You use your own spring action so you can land, you can press a little bit, and then you roll, but it landed right on the shoulder. Fracture versus dislocation versus fracture of the clavicle. These are my thoughts.
I'm a doctor. I know what's best.
Holy syringe. What? Holy cow. The syringe had like holes to hold it. We don't actually use those very often in the emergency department. Those are typically seen at like the dentist's office, and they typically re-sterilize them so they're clean for the next person.
So this time, I need to be very careful in my excision of the sternal cavity. So let's take
Oh my gosh. It doesn't rip that easy. You know, you have a lot of muscles attaching it. When a cardiothoracic surgeon is in there doing surgery on the heart, they are super delicate, very good, and they have to deal with very fine movements.
this expert precision.
Nice. I love the random cow.
Watch game off!
Oh my gosh. We do use different types of medical saws in the hospital, but not a chainsaw. I've seen lots of chainsaw injuries where people hit themselves, they get their hair caught in it, they hit their head. It definitely messes up the tissue.
Grab the lung and rip it out of there. No need for that. No need for the other lung.
Oh, there you go. So super good. He actually grabbed both lungs.
Oh, we need to hurry up here. We don't have much time. It's okay. Shh, Bob, it's okay. I gotcha. I gotcha. I gotcha.
We do have moments where may straddle up on top of the patient. Say you need to be doing CPR and they're moving. Sometimes it's easier to be on the gurney or the hospital bed at the same time.
Okay, all right. Try again. Take a second mulligan on that.
It was fun to check these out. I loved it. Very entertaining. Make sure that you check out the merch that's still limited run. It's in the link below in the description. If you guys have more clips from Markiplier, let me know. And as always, do me a favor, check out this playlist right here. Binge watch everything. And make sure you subscribe. Turn those bell notifications on and hit that like button for me. Thank you so much for watching and stay healthy, my friends.